Good morning. Today we're going to hear about the Ministry of Health's systematic health plan in Arab society. And we're going to hear about it from the expert on this plan, Dr. Nour Abedelhadi Shahbri, who is head of the implementation of that plan. Welcome, Nour.
Hi, nice to be here.
Nour, before we talk about the plan, please tell us a bit about yourself and your background.
My bachelor is in medical laboratory medicine. I have a master in health system management and business management. And my PhD is in public health with the specialty of the Arab society decision making, health communication, and cultural sensitivity.
That's great. And what was your job before you took on this latest responsibility?
Well, I've worked at the Arab desk in the corona crisis. So I planned and managed the programs that are specialized with promoting vaccines in the Arab society because it was my profession and my PhD.
Okay, terrific. So before we actually hear about the plan itself to reduce the disparities, let's hear a bit about the disparities. In terms of health status, tell us a bit about the disparities between Arabs and Jews in Israel.
Gaps are in a lot of sectors, life expectancy, infant mortality. If we also look at the mortality rates per 100,000 population for selected causes are also much higher. For example, diabetes mortality, heart diseases, and obesity rates among seventh grade students in Arab society. It's about 43%, higher than those in the Jewish society, 32%.
What about health behaviors? Are we seeing differences there as well?
Yes, of course. A deeper look into the health behavior data shows that disparities are not only in the utilization of medical and health rights, but also in the adoption of health promoting behaviors. For example, uh, women reporting undergoing preventing screening for cervical cancer, also, the smoking rates among the Arab boys are significantly higher than the Jewish boys, and likewise among Arab men compared to the Jewish men. And the percentage of the Arab children, grades 5 to 10, who don't engage in various physical activity in their free time is higher for both boys and girls in the Arab society compared to Jewish boys and girls respectively.
Wow, those are some very serious gaps, very troubling. So what is the Ministry of Health or Israeli healthcare in general doing about this?
So we've started in 2020. The Ministry of Health initiated the development of the systemic program to reduce health inequalities in the Arab society. More than 100 participants from multiple sectors took part in shaping this program. We've described the health status of the Arab population and offered extensive recommendations for the interventions into improving the health outcomes, not only the health behaviors, and reducing health disparities in the following key areas: diabetes, women health, early childhood, smoking, and mental health. Each field of action was planned through a systemic lens, emphasizing regulation and incentive mechanisms, health literacy, right utilization, workforce development, accessibility of the health infrastructures, information and research, and improving living and environment conditions that affect health.
What do you think is one of the most important issues to work on in the years ahead?
So we've have started in working on these challenges. Among these efforts, we have a 3-year support program for the HMOs to expand the professional medical services and establish new clinics in more than 25 Arab localities. We are also establishing a municipal health units to integrate health into all policies in the local health, lead awareness and behavioral change programs, developing health promoting infrastructures. We are also developing health promoting infrastructure in the Druze and the Cherkessian communities. We are working also with the civil communities and supporting them and funds them working in the health promotion, awareness, campaigns, ambassadors for health programs, and also professional training. Things that we are doing in the paramedical workforce, because we had a gap between the Arab society and the Jewish society in the paramedical workforces. The Ministry of Health launched a health ambassador programs in partnership with the National مفعل باز, granting scholarships for 120 Arab students studying underrepresented health professions such as psychology, speech therapy, occupational therapy, nutrition, and genetic counseling. We had also special programs in the Bedouin community and the East Jerusalem community that are dealing with children's safety, also the genetic and family planning programming in collaboration with the community genetic department, and a lot of multisectorial leadership, such as the local councils and religion leaders.
That's so impressive. So many things going on at once. It's been a very tough 2 years in our region with the fighting in Gaza. Have you been able to keep these programs going despite that, and how have you managed? Because there must be so much sadness and worry and tensions, and how have you managed to, well, both for yourself but also for the programs, how do you keep it going during these tough times?
Wow, it was a really tough times. It's also to keep this program ongoing, and in the other side to keep the trust of the people in the health system during this tough period. Our goal is not only to make quality health services accessible, Professor Baruch, but it's also to foster the cultural and the value-based transformation, one where health is seen not only as a right, but also the responsibility through the partnership that we strengthen. That we strengthen the communities, we strengthen the health system workforce, the Arab and Jews relationship at the system workforce. It was tough, but we have decided both to keep the continuity of this health effect and this effect of program and the impact of the program, because we want to, through these partnerships, we want to also encourage and strengthen the communities, the quality of life, and promote equality. We move toward a future with no health disparities, because we believe that if we work on this and if we keep our shared, if we keep our mission in the center, so we can keep the system working during a lot of crises. We've worked together in the corona crisis, and I believe although there were a tough situation, we led the vision to build a health system where equity is not an aspiration, but a lived reality for every community.
That's so important, and it must have been challenging, but I guess the right person in the right place at the right time can really make a difference. You and I have talked, that's a few months ago, we talked about maybe doing some research and writing together, and perhaps with my colleague at Harvard Kennedy School. And as you're talking, I'm come up with a certain idea for a possible study, which I'm curious what you think of it. You know, Israel is not the only country with a minority population. And in many places in the world, minority populations face challenges in the health system, not just in the health system, but also in the health system in terms of health status, health behavior, access to
Absolutely.
services. What do you think of the idea of us trying to reach out to people like us in other countries who are dealing, of course, each one is different. Each country is different. Each challenge with each minority group is different. But maybe some comparison study about what types of challenges there were, and also what the countries have done and not done. Honest look about where is the glass half full and where is it half empty. Do you think that might be of interest?
Absolutely. I think that this opened for us a change or a vision for learning. So I agree with you that the majority of the minorities in the world have, all of them are challenging a lot of health, socioeconomic challenges. But we can learn from each other in dealing with these challenges with our facilities. For example, in Israel, the initiative moves beyond awareness toward measurable changes, strengthening prevention, improving access to quality care, promoting culturally adapted health services, and empowering local leadership to become a true engine for health promotion. maybe in other countries we can learn about some taboo issues that we are dealing in our minority Arab society, and we can learn about this from the aspect of the Arab society and cultural competence, but also in the aspect of the system vision and in the system aspects of how to lead a policy, how to get access, or how to deal with the accessing of the services to a lot of communities that are dealing with geographic, psychological burdens that can help us to understand how to increase the trust of the people, especially the minorities in the health system, because we are dealing with a low trust level generally in this population in the one hand, and in the other hand we can learn about the agility of the systems forward leading special policies for these populations.
So we have viewers in a lot of different countries, the United States, India, Egypt, Ukraine, everywhere. And I appeal to those
Wow.
viewers who are in positions similar to me and Nour, who care about these issues, who studied these issues in their own country. Please reach out to us about the possibility of doing something together. I bet this is the kind of topic where we wouldn't have any trouble finding funding for conferencing and for our own time to write papers. So thank you all, and particularly thank you, Nour, for joining us today and for the work you do every day of the year.
Thank you. Thank you so much for the unique opportunity to be with you and to be with this unique program.